There may be nothing more frustrating than a medical problem that painfully drags on and on. About 7 million Americans suffer exactly that, a chronic wound that won't heal. Chronic foot ulcers, for example, are extremely common in people with diabetes, and they can be deadly serious. More than half of foot ulcers become infected and require hospitalization. About 20% of them require an amputation. Chronic wounds are also expensive. We spend about $20 billion a year to manage them, and it can be incredibly complicated.
Every wound behaves differently. Some wounds drain a lot more, some wounds drain a lot less. Some wounds are located on the bottom of the foot, some on the top of the foot or in the leg or ankle region. Some wounds are deeper, some wounds are more superficial, and all of these characteristics require a different type of dressing.
That's Dr. Alexander Raiselman, Associate Professor of Medicine at the California School of Podiatric Medicine and co-director of the Limb Preservation Center at the University of California, San Francisco.
Some wounds require dressings to absorb more of the fluid. Some wounds require more moisture. So there's always this different balance that we have to create with every wound. And that's why we have so many dressings. We have thousands of dressings on the market for every different style of wound, a different stage of the wound, so to speak.
One may be good, or two items may be good at the beginning of the wound, but then they have to be removed. So it makes a lot of decisions making throughout the course of a wound healing. When I order different types of wound care for a patient, I would use these two at the beginning. 2 weeks later, I would have a call from the home health nurse or the family caregiver saying, it doesn't look right. I think it's too dry now. We need something that's going to work for this stage.
Vicki Fishenik is a geriatric nurse practitioner and director of clinical affairs for Osnovative Systems, a maker of wound dressings. She says moisture control is most important in getting a wound to heal.
You need to have a moist healing environment in that wound. You can't have it too wet, not too dry. So it needs to have a certain amount of moisture. If it's too dry, they call it a desiccated. It's too dry for it to close. So that also can hinder the wound healing.
But a wound that's too wet can also be disastrous.
The drainage from the wound in excess amount causes problems because the fluid from the wound carries a lot of inflammatory factors. And these inflammatory factors and enzymes, if they're in abundant amount, they will actually cause wound to delay in healing. It will cause wound to get bigger in size, and the wound will grow and destroy the healthy tissue rather than improve. So in small amounts, drainage is normal. But once the drainage increases, then that's problematic.
However, many chronic wounds have an area that's too wet and another that's too dry, all in the same wound. How can you bandage a wound like that?
There's a lot of products out there that you can use on a wet wound, but you can't use it on a dry wound. And you've got products you can use on a dry wound, but, I normally had to use a combination of dressings, either a foam dressing and added seaweed dressings or added absorbency, and then maybe some skin preps to make sure that the skin doesn't get macerated. And sometimes if it was heavy exuding, we'd have to add moisture barriers. There was times we'd have to add different types of topicals, and the pharmaceutical topicals get really pricey, and it's hard for patients to afford that particular type. I mean, some of the topicals we were using were $400. Early on, that was kind of where I practiced. We used this, and we added this and this.
That's why doctors have long sought a dressing that would work on just about any wound, either wet or dry. Now they're available. So-called smart dressings.
The smart dressing in Luxtra is able to adapt for those changes in a wound. It's able to go from a wet wound or start from a dry wound. It's able to sense the wound bed's needs. It's got a technology that allows it to absorb and lock in that drainage. So even if the patient is sitting on the dressing, stepping on the dressing, or under some pressure, it doesn't allow your wound drainage to seep back into your wound bed, which then resupplies that bacteria.
Smart dressings even know how much moisture to absorb. However, on a wound that's too dry, smart dressings work the opposite way. They sense the lack of moisture and supply some of their own. Raiselman says smart dressings can be used for almost any wound from beginning to end, but they're especially good for some patients.
Patients that have chronic wounds that they can't handle daily dressings or the frequency of the dressing to be done every day or every other day, these are the patients that could definitely benefit from the smart dressing, because you can leave this dressing anywhere from 1 to 7 days without disturbing it. All of that depends on the type of drainage and the amount of drainage that occurred. But once the drainage is controlled, the smart dressing can be left on there for up to a week without a problem.
And when the dressing needs to be changed, Raiselman says it can often be done with a lot less pain.
For the most part, the smart dressing does not produce pain. Although occasionally we have patients that no matter what you put on, no matter what you take off, they're still going to complain of pain. But because this wound dressing keeps moisture, there's an interface between the wound dressing and the wound itself. When you remove the dressing, it's not painful. It doesn't tear off or damage the underlying tissue that's been built. If the dressing became too dry, then when you remove it, it would actually cause pain by tearing and damaging the surface.
We've been asked, is this dressing embedded with some type of pain-relieving chemical? And it's not. It's just that Luxtra has the ability, and as a clinician, I always try to explain this. It brings down that inflammatory cycle, which then, of course, decreases the pain. The inflammatory cycles in a wound is what causes the pain, and Luxtra addresses that really well, and it corrects for the breakdown of skin around a wound, which can be irritating or painful. So that's how it addresses the pain. It provides that perfect environment for a wound to heal, and it doesn't allow it to get too wet or too dry. And when your wound is wet, it's painful and uncomfortable. When it's too dry, it's also painful and uncomfortable.
In the future, smart dressings may be able to do even more. For example, sense when medication is needed in a wound and dispense it. To some doctors, it all sounds like a dream come true. In fact, Fishenix says some doctors think it's too good to be true.
Where I have won most of my physicians over that have been a little skeptical about, like, really? I'm going to use this dressing. I'm like, I understand. I was you 4 years ago feeling the same way. But this product, if you allow it, and that's where we've healed out some very long-term wounds, 8 years, 3 years, 14 years, because physicians are like, you know what, I'm not sure if I feel comfortable just using the dressing. And I always tell them, listen, give me your worst wound. Give me the wound that you have done all your other treatment choices and you still have that. Those are the wounds we're healing out, and that's when I finally get them to understand.
You can find out more about smart dressings and all of our guests through links on our website, radiohealthjournal.net. You can always find all of our shows on iTunes and Stitcher. Our production director is Sean Waldron. I'm Nancy Benson.
Kid, let me paint you a picture. Tuesday night, your cog belt goes bust. Who will help you get what you need fast, without the hoops, hurdles, or headaches? Grainger, that's who. I love Grainger. They got a wide variety of products and solutions. Grainger makes it easy to get everything we need and answers for when we're not sure what the answer is. Now, kid, let me paint you another picture. It looks like a mop, a basement bathroom, and you all over it. Get it? Got it? Good. Call clickgrainger.com or stop by. Grainger, for the ones who get it done.
When the leading antihistamine and Nasacort go nose-to-nose, Nasacort wins, stopping more of the chemical responses that can cause your nasal allergy symptoms. And when you stop more causes, you get 24-hour relief from sneezing, an itchy runny nose, even congestion. It's prescription-strength medicine available over the counter. Nasacort Allergy 24-Hour. Stops more of what makes you miserable. Use as directed.